This is week 9, and this week I focus on facilitating the design and implementation of a program where parents may receive assistance and become more informed of the different ways they can help their children achieve success at school. During the talk with students, I find that students suffer a lot from examinations, especially the senior students who are going to take a Gaokao soon. They can barely fall asleep at night, and some have ever thought about committing a suicide. Wenzhou Thaven's People's Hospital reviewed relevant data that the age of patients with depressions has been declining in the past 10 years. About 50% of the patients with mental diseases hospitalized in the hospital are teenagers, many of whom are children aged 12 or 13. According to the China National Mental Health Development Report, in 2020, the detection rate of depression among Chinese adolescents was 24.6%, including 17.2% of mild depression and 7.4% of the severe depression. Behind these realistic and cruel figures is a grim fact that we have to face up. Teenagers are experiencing a psychological crisis. Releasing the pressure is necessary for students to ensure they are mentally and physically in the best state to sit the exam. Actually, this situation worries parents greatly, and they don't know what can they do. Because our school is a boarding school, students stay in school from Monday to Friday. Parents can only see their children on weekends, and we are not sure what's going on with their children at school. In order to better help parents assess the mental health of their children, we cooperated with Wenzhou Thaven's People's Hospital and arranges a series of lectures for parents regarding mental health. The first lecture was held on Wednesday. Dr. Lin brought a class themed on teenagers' bad emotions and behaviors, conditioning with home to parents. From understanding adolescence, empathy, talking about emotions, the source of emotions, the correct way to deal with teenagers' destructive emotions, as well as the communication skills commonly used in one-sided interactive discussion, such as a combination of confirmatory listening, open questioning, and closed questioning, differentiation, and expression. It lets parents learn to appreciate their children's changes and actively deal with the challenges of adolescence with their children. Teachers, parents, to recognize their children's emotion, correctly guide their children to express and understand, and to accept them. The lecture lasted for an hour and a half and ended with a pause. The parents actively participated in the interaction, seriously discussed, and shared their experiences with Dr. Lin. In conclusion, there is a more anxious parent behind every anxious child. If the parents want to cheer the children's on, they must adjust their mentality. Once parents change their attitudes and as a means of education, and are good at encouraging and communicating with their children, children will have a noticeable change.